Chris, is it working? Or do we both have to have that many followers? I don't know. Was there some weird filter on me? TikTok, I swear. Uh oh, I think we might have got him. Let's see.
Hello?
Yo,
Hey, can you see me or just hear me?
I don't know. I think I could just hear you.
Interesting. I don't know why
But you're on.
the visual is not there. I don't know.
Yeah, I have like lipstick on or something, man. I don't understand.
Oh boy, that's
Like,
exactly what I need. How you
yeah,
doing,
there's
Doc?
there's some weird filters that this thing puts on you.
Oh yeah.
Yeah, I'm like, I swear I don't have lipstick on. I promise. No offense to all the new age people or whatever, but I don't even wear chapstick.
How's it going?
It's going good, man. What's going on?
Doing good. I flew back with the family. They came to visit for a little bit. I got back on what was it? Thursday, and just been getting some things in order. My school, I think, just sent my transcript to the board, so I'm waiting in the mail for my license. Virginia doesn't have a state test, so I'm just waiting on that.
Oh, nice, nice. Did you already? So you already did your graduation ceremony?
No, they only have it in December, unfortunately, so we don't get one for the
Oh,
summer. Yeah,
boo!
I know, right?
And what school did you go to?
STU.
Okay. So if you guys are watching, like, if you guys aren't following, make sure to go check out his account right now. He's got some very interesting fact checking information about the profession of chiropractic in particular. And one of the reasons we wanted to go live today was, I think his account is really good at spreading that information and just clearing it up because a lot of people have a very misunderstood perception of like the education of chiropractors and what their scope of practice is. And I think he does a really good job of clarifying that, even though he gets a lot of hate on his page because they always say the haters are the ones that find you first. People that don't even want to believe the factual information that he's giving to people. He's literally giving you sources, citations, and people don't want to hear it. But a lot of people are unaware of the educational rigor that chiropractors actually have to go through. And so that's kind of how we linked up. He actually managed to come out to my clinic and observe for a couple days. So yeah, make sure to go give him a follow. And yeah, want to talk a little bit about that of why you started creating that content?
Oh, well, thank you, Dr. Hightower. That was an amazing intro. I think you completely nailed it. I wanted to share information. A lot of things I would say is common knowledge for those in chiropractic school, like what we learn, how we can help patients. But I had a feeling, and I think I was right about that feeling, that the for people that are not involved in either healthcare or specifically chiropractic, they don't really know all that we go through, all the qualifications that we have, and the ways that we can help. So I just wanted to share that. As you know, I guess I technically just finished my last day of the semester, but I'm still unlicensed at the moment. I'm still waiting on my license. So nothing really to offer besides information. I just wanted to share some of that stuff because I feel like there's been a gap of information between what people either think or assume or have been told and the truth. And I just want to try to bridge that gap. And you've been amazing in helping me do that. I know you've made a couple of videos as well, and I guess I just did a bunch of little ones instead of long form content, but I might be graduating into that as I get my license and everything is official. But yeah, I thought there was a little bit of gap in what people knew. I just wanted to bridge that gap a little bit. And thank you again for inviting me out. And I learned a lot shadowing you and everyone at the office. And it was fun. I never got to go anywhere during my schooling. So you were like my one trip, and it was well worth it. And yeah, I had a great time. So thank you for that.
Yeah. We got to go on a hood safari of Albuquerque, so we got to see
Yeah.
some of the rougher parts of town. Probably not what his neighborhood is like in Virginia, but
No,
yeah,
not the exact same. No. But yeah,
yeah. A
thank you
lot of
so much.
people. Is there any way to make the split screen? Or am I split screen on yours?
So I tried tapping some things and it says like the host, which is you, has the visual, but for some reason I only have audio. It says
Did that change
live.
anything?
Oh wait, let's see. Something popped up.
This is my first time ever going live on TikTok, guys. So bear with us here.
Let's see. We got the mic going. Let's see if we can turn the camera on.
And big screen, let's go. And yeah, I'll let I'll actually talk a little bit about my educational background first, I guess. Is so chiropractic school, you are required to have a bachelor's degree to graduate. Most of the schools require a bachelor's degree to enter. Some of them you get it in the process. They're all 4-year programs. Some of them are accelerated, some of them are not. So some of the programs are a full 4 calendar years. Actually, I think the new program at University of Pittsburgh is going to be the most accelerated program that's ever been created. It's going to be like 2.5 years or something like that, which is sort of where a lot of the curriculum is going across the board. I'm seeing a lot of physical therapy programs also shortened down to 2.5, 2.25 years, which I actually think is probably a good idea, given that the scope of practice is somewhat limited. That I don't think we actually need the same professional degree education as medical doctors, because they are going to move on and have broader scopes of practice. That 4 years might actually end up being overkill for physical therapists and chiropractors. Unless the scope expands, which it has in New Mexico with advanced practice. So if the scope expands, then yeah, it should go back to 4 years if we're able to do some limited prescription rights and things of that nature. So yeah, my undergrad degree, I was a biology and chemistry major. So my bachelor's of science degree is in biology. I worked in a biology lab for a good year and a half, and I worked as a groundwater chemist as well. I was about 4 hours shy of my bachelor's in chemistry. Little did I know I had to retake the core classes again to get the second bachelor's. Then I got my bachelor's degree in health and wellness, and I also have a bachelor's degree in anatomy. I earned the second one during the course of my chiropractic education. After my 4-year doctorate, I got my Master of Science degree in exercise science with a specialization in rehabilitation science. After that, I got another 4-year doctorate in naturopathic medicine, which is a soft tissue version similar to chiropractic. I'm triple board certified. I'm certified by the American Board of Independent Medical Examiners. I'm board certified by the American Chiropractic Neurology Board, and I'm board certified by the American Academy of Pain Management. What else have I done? So I have 6 college degrees so far, 3 graduate degrees, 3 undergraduate degrees, and then doc here. I can call you doc now, I guess, right? Because you graduated.
I guess so.
Congratulations. How does it feel?
Thank you. Honestly, I haven't really processed it yet. I'm still going through it. I think when the license arrives, it might hit me a little bit more. But right now, I'm kind of like in this limbo where I'm not in school, but I also can't really work as a chiro yet. So,
Mm-hmm.
but it feels good.
But you have a doctorate degree. Do you have your diploma already?
No, waiting on that.
Okay. But you finished the curriculum. You've officially graduated.
Yeah, without the ceremony, but yeah.
All right. And so tell me your education background.
Oh yeah, so I'm from Virginia. I went to Virginia school called James Madison University. Got my undergraduate in business management with a minor in business Spanish. Supposedly, when I applied at the time, it was one of the top ranked business schools in my state, if not the country. So that was the main reason I wanted to go. When I was in high school, I did not consider becoming a chiropractor. I've had sports injuries. For example, in high school, I had a dislocated shoulder while playing basketball, and I saw, I went to, I believe it was an orthopedist originally, and they recommended surgery, which I didn't want to do at that time, even though I lost a good amount of range and function in my dominant arm, my right arm. And I went to a chiropractor instead, and I was able to move as much as I originally did before the injury in one visit. And that was when I was like 15 or so. And although I was very grateful for that, I didn't immediately think this is exactly what I wanted to do. I still wanted to go to business school because I knew I wanted to have some type of business someday. I never knew which type of business that would be. And then that chiropractor that helped me retired and wanted to retire. And that's what got me thinking, since this person helped me so much, I wanted to kind of continue on how he helped me and help other people in the same way. And it's pretty soft tissue based, kind of like what you were saying earlier, the naturopathic route. He didn't call it that. I don't think he went to that type of schooling, but that was kind of like his style. And then I went straight from, well, I graduated from James Madison, and then I did some extra science classes at the community college to get those science requirements to apply to chiro school. For my school, they didn't require you to major in a science-based degree, which is why I had to pick that school in particular. There are other colleges that have, as you know, other requirements, and so I went straight from those sciences that I took the prereqs to SCU in Los Angeles County, California. And so, yeah, I just have the basic undergrad and one doctor, so nothing to compare to your schooling. But
yeah, I'm 40, so you have plenty of time if you want to go that route. And so when I was applying, so this is probably 2006 or 7, I think. And I guess I'll give you just a short version of my chiro story. You know, I played college football. I was a linebacker. My chiropractor in high school was super helpful for me. Was able to fix a lot of the back problems and things I had like that. So I was aware of the profession and knew that it was like a very helpful thing for me. And at the time, I didn't see it any different than like a dentist or optometrist or anything. I didn't know there was all this stigma or whatever about it. It was like, hey, man, if your hip's off, you go in there, the guy treats you once or twice, and then you're good. Just like, you know, you get your teeth cleaned or you go get your glasses or your orthodontist or whatever. And so when I graduated, you know, bachelor's degree, there's not a lot of career paths necessarily. So usually you'll have to go through and get at least a master's, if not a PhD. And then most PhD biologists, if you're actually working as a biologist, they rarely make more than $65,000, $70,000 a year, which is it's a good living if you didn't have all that education. But for, you know, 6 extra years of opportunity costs, it's not the best idea for most people. So I started looking at healthcare. I started thinking about pharmacy school. I never wanted to go to medical school. There was just never anything that interested me in medicine as far as specialization. I never had any experience with physical therapy either, so I was unaware of that. I just thought, you know, the typical thing that other people think is, you know, after you have surgery, you go do arm circles or whatever.
Yeah.
And physical therapy has come a long way since those days. You know, they've moved from a bachelor's to a master's to a doctorate. So, you know, most physical therapists do a really great job these days. But, you know, where chiros are almost exclusively outpatient orthopedic, a very small percentage of physical therapies actually work in that realm. You know, the vast majority of PTs are you know, working in different realms, stroke rehab, you know, home health, inpatient in the hospital. There's just a lot more inpatient than there is for chiro. So, you know, my chiro had a nice work-life balance. He played a lot of golf, and it just seemed like something that would, you know, I kind of looked up the average salary, and it seemed like most chiropractors made about $100,000 a year or so. And so I applied to one school, and the first school I applied to, I got into, and so I packed up my things and I moved to Dallas. My brother lived in Dallas at the time, so it was a nice fit as well. And boy, like, you know, like I said, I was in an accelerated curriculum. So back then we would have 10 classes per trimester. So we had 3 trimesters in a row every single year with roughly between, you know, 30 hours a week. So we were taking 3 to 4 exams a week. And I had some friends that were in med school at the time, and it you know, I don't know about the depth of the curriculum, but it seemed like we had more volume, at least, for the didactic portion, more tests, more frequent tests. And that's what, you know, kind of what a lot of the anger on your page comes from, is when you're just clarifying that since the chiropractic curriculum is predicated and based on the medical school curriculum, it was literally almost copied and pasted, along with the board exams. A lot of people don't realize chiropractors take 4 national board exams, where physical therapists only take 1. Naturopaths only take 1. They take 4 because that's how many board exams medical curriculum used to have. Chiropractic being one of the oldest professions in the United States, probably the 3rd oldest doctorate profession after dentistry and medicine. They copied the curriculum almost verbatim. And so, while there is, you were just being very factual and literal. And so everybody wanted to have an argument that you weren't making, right? They were saying, well, that's not clinicals, that's not residency, which you never said that, right? You just said the pre-clinical education is fairly comparable.
Absolutely.
To their point, because they are full physicians, I think they do need more clinical education than we do because they're working in so many different fields and specialties. They need to have experience in OB/GYN. They do need to have experience in surgery, where since that's not within our scope, we're never going to be doing that. So it doesn't really make a ton of sense for chiropractic students to spend their time on an OB/GYN floor or doing a surgical rotation or things of that nature. So of course, medical school is going to have a more in-depth and more expansive clinical experience in their 3rd and their 4th years. I mean, that's the nature of the profession. And, like they say, most of your education actually comes in residency, because what people don't realize is medical doctors and osteopaths, they can't even practice in the United States without at least doing 1 year of residency. So they can't even get licensed until they match into residency, do a full year intern year, and then they're not board certified. So they still have to finish an entire residency in whatever field they pick. And the scary thing about being a doctor is, if you pick a field that you don't like, in order to change specialties, you would have to go into the match and then re-enter another specialty. So say you did 3 years of family medicine, decided you hated family medicine and wanted to be a radiologist, you would have to go back into residency and start all over again and do another 4-year residency, basically making minimum wage. So I think a lot of doctors are upset with the choices they've made, because they were pigeonholed into their field, whether it's family pressure or societal pressure. They're forced to, study and, study for the MCAT and all that stuff at such an early age that they don't really have any work experience. And so by the time they get to decide whether they like the field or not, they're already stuck. They're already, $300,000 in debt, and they're stuck in a specialty. And then they realize the system's broken, right? That the administrators run everything, that the insurance companies run everything, that they're forced to do clinical efficiency instead of spending time with patients like they want to. And I honestly think a lot of them are sort of jealous at, some of the time that chiropractors can spend with their patients, especially being cash-based. And I honestly think there's some hatred based on some quackery within the field. We both acknowledge that there's more quacks per capita in chiropractic than there is in like traditional medicine. But there's bad and good apples in all fields.
Yeah.
But to paint everybody with a broad brush, I mean, you went to a pretty evidence-based school. I don't think your school probably taught chiropractic philosophy or subluxation-based care or anything like that. Am I correct?
You're correct.
And so with chiropractic, it's a field, it's a profession. And so we have a lot of things that we can do: soft tissue, rehab, nutrition, imaging, and manipulation, of course, which is what we're known for. And, a good, evidence-informed chiropractor will use manipulation when they need to, which is to restore joint motion. And it's really a subset of patients, right? It's people that are subacute, that are within a particular demographic, particularly post-puberty and premenopausal, pre-osteoporotic, folks that are non-surgical candidates, that have that subacute pain, particularly sacroiliac joint pain, rib pain, and subacute neck pain. I mean, there's standard guidelines for manipulation that the APTA, the orthopedic group, has put out. And, there's a reason why they teach it at every single physical therapy program and every osteopathic program in the country. It's because, manual therapy works, and there's a lot of varieties, whether it's soft tissue, fascial distortion, HVLA, or even just active movement, like active release technique and things like that.
Absolutely.
So you have any thoughts on like some of the comments, or how about some of the miserable doctors that are reposting your stuff? My favorite thing is they're accusing you of rage baiting when they're literally doing the exact same thing. If your entire page is you reposting people to take a shit on them, literally with the intent to get comments in the comment section of people piling onto that person, because that's when you get the most engagement on your page. You're literally doing the exact same thing, but then you have your nose in the air like, no, I'm just saving people. I'm informing people. It's very different than what this person's doing. Like the nerve of that lady to call you a rage baiter when that's like her literal shtick is rage baiting. And then my other favorite thing is that she's literally in the middle of a malpractice lawsuit currently. And you guys can Google this. It's publicly available. If I was an attorney for somebody in the middle of a actual malpractice lawsuit, the last thing I would be doing is going out there and criticizing other practitioners, other students, and people like that. Like, don't throw don't throw stones if you live in a glass house. And there's no reason for people to be attacking each other or each other's professions. As you eloquently say often on your page, everybody has their place. If somebody's having a heart attack or they have a broken bone or something, please don't show up at our office. There's nothing we can do for you. You need to see a physician. If you need to have your diabetes managed or you need, an injection or a medicine, there's nothing we can do for you. But if you're trying to not be on opioids and you're having pain, and that pain is affecting your life and maybe to the point where you're suicidal, and again, people are giving you opioids or things like that, like, a lot of our colleagues are people that can help you a lot. And to try to paint everybody in a field with a broad brush. And as you or somebody else said on her page, it's like, well, how do you know what their education is? Have you been to chiropractic school? And of course, she didn't have a straight answer for that, right? She says, oh, what are you trying to, don't be coy, blah, 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 blah. But literally, you don't know unless you've actually gone. And as you and I have both said, we had physicians as professors in chiropractic school. I've worked in medical clinics with physicians my entire career. I've worked with family doctors, sports medicine doctors. I'm not saying that I'm on their level, like clinically speaking, but they recognize that I have expertise in my niche, in my field, and they would defer to me on those kind of things. They wouldn't think that they knew orthopedic testing better than me or they understood muscle physiology better than me, just like I wouldn't understand pharmacokinetics as well as they do. Having that mutual respect is what's the best for the patient. What's not the best for the patient is going on social media and attacking, other professionals, particularly students, and particularly people in a field that, as she acknowledges that she's better than. It's punching down, it's childish, it's not protecting anybody. It would be like if we got on here and started attacking massage therapy school or, I don't know, something that's a less expansive education. Like massage therapists are great at what they do. They have their scope of practice. I have many massage therapists that work with me. Same with physical therapists. We don't need to denigrate people's education or their fields. And it confuses the patient when they're trying to understand like whose side is on who, and these people are attacking these people. I mean, it doesn't do anything except for, as she claims you of doing, gets her views on her TikTok page. And she claims that, oh, this and that and the other. But the thing is, she's obviously really wealthy. She's a plastic surgeon, very well off, obviously, 90210 or whatever. She doesn't need to be doing TikToks, but she's also desperate for the attention and the followers and, all that stuff as well. Or she wouldn't be taking time out of her day to make attack videos on students. I mean, it's really childish. It's really embarrassing. I mean, she definitely got a block from me because I'm not going to come out here and attack physicians. I think physicians are fantastic, but the ones that are hiding behind anonymous accounts and leaving hateful comments, I mean, those people can all go kick rocks. Nobody needs that. The patients don't need that. Fellow practitioners don't need that. And especially when you're speaking about something, like you said, that they don't even know. Okay, you can get advanced placement in chiropractic school. By all means, go get a chiropractic degree and show us how easy it is, and then you can comment on it. There's only a few people in the world who have gone to medical school and chiropractic school who can, sort of weigh in on that. And that's probably, it's what's his name? We were just talking about him the other day, Dr. Haldeman, for example, right? He's an MD, PhD, DC. Mm-hmm. He's somebody who I would respect his opinion if he wanted to ask me what the curriculum differences are. For everybody else, you can go look it up. I mean, you can look up the schedule, the coursework on, most medical schools' websites, and you can look up the curriculum on the chiropractic schools' websites, and you can put them next to each other. If you want to attack his sources and say, oh, that's from 2001, and the AMA says this and that, okay, go look it up. It's fairly simple. And again, we're only talking about preclinical education here. We're not comparing residency. We're not comparing clinical work. We're literally just talking about the classroom work that prepares you for step one or part one of chiropractic boards, which in my opinion are fairly comparable.
Right. Yeah. I mean, you made a lot of really good points. people want to, I guess, I don't know if extrapolate is the word, but they want to like add on to things that I didn't talk about. And people want to like play sides, like us versus them, when in reality, the way that I see it is like we're all doctors that our goal is supposed to be like helping the patients in different ways. And so like different doctors study different things and different doctors treat in different ways. And it's more about like complementing each other. And it's sad that, like you said, people intentionally try to create like a divide, like they are different, therefore they're worse. And I tried to explain, and I guess I was kind of made fun of it, like being different does not necessarily mean you're worse. It just means like we provide a service that others aren't as good at, and vice versa. They provide services that we don't. And so it's more about like attacking the problem or approaching the situation as a whole, instead of like saying like this is the way and there's no other way. Like, although I talk about a lot of chiropractic stuff, I never try to convince anybody that like you shouldn't go to any other type of doctor. It's more like I'm providing more of like the option, like, here, this is what's available to you. You can choose what you want given what I said and what you've heard before. And so it's more about, for me, like giving an option and just presenting facts, as opposed to like talking about other people specifically and just trying to embarrass them. But after a while, I mean, there's been more than one person doing it. So after a while, I wouldn't say it gets old, but like it doesn't really affect me as much. So although I'd rather not have any of it. It's more like, oh, okay, this is just another thing. And I know it's mainly about the studying, because out of the 60 or so videos that I've made, only like 2 out of the 60 really like got a lot of people riled up. And so like the 90% that didn't, like I kind of realized like that's probably why, when I try to talk about like the studying specifically, but like you said, it's more preclinical stuff, and they just want to extrapolate to overall studying. But yeah, that's what I think about it.
Sure. And the fact is that medical school is harder to get into than chiropractic school. Everybody knows that.
Yeah.
The quality of student on average of medical school is going to be the best of any professional school. Better than pharmacy, better than nursing, better than physical therapy, better than chiropractic. So if you just wanted to take a mean average of the students, yeah, you're going to have better students on average in a medical school. The other thing about that is I think they get so defensive because a lot of these doctors, they spend their entire life focused on the school. They take the MCAT 3 or 4 times. They take gap years. They apply to all these schools. It's incredibly hard to get into some of these medical schools. Only 3, 4, 5% of people get in, where 30, 40% of people get into chiro or PT school or things like that. So there's definitely a bottleneck. And so when anybody compares themselves to the amount of quote unquote hard work that these people take, I think they take it very personal, and they don't want to be compared to anybody. They want to be the kings of the castle. And medicine forever has tried to run a monopoly on healthcare. I mean, a lot of our followers don't know. You can look up the 1986 Wilk ruling, Wilk versus AMA, and against the American College of Physicians, where the American Medical Association was found liable for monopolistic practices and trying to eliminate several professions, including chiropractic. And they did that by all kinds of uncouth means. They tried to distribute literature to high schools and to guidance counselors, making chiropractors look crazy. They spread that information through the media in a very similar way that the Mockingbird media did as well. They also made it unethical, so you would lose your professional membership if you would refer or work with a chiropractor for medical doctors. This is up until 1986, guys. And all this was being bankrolled and funded by Big Pharma, obviously. And, they tried to eliminate several other professions, and they always have. They've tried to limit podiatry. They've tried to limit nurse practitioners. They've tried to limit optometry. They've limited physical therapists as well. They spend millions of dollars limiting what they call scope creep of nurse practitioners, podiatrists, chiropractors, everywhere, trying to monopolize. And, they managed to grab osteopathy and pull it inside of its own organization as well, where osteopathy used to be a much more distinct profession. They were always physicians. They could always prescribe. They always did manipulation. But, they've essentially, swallowed up osteopathy, which used to be somewhere like a blend of a chiropractor and a medical doctor in the past. So, while they've lost that lawsuit and they've lost the ability to squeeze physicians and do things like that anymore, the ghosts and the long-term ramifications still live on, and they manifest themselves in these ways, particularly in older people. And then they utilize, very rare occurrences when somebody gets hurt, when they go to a chiropractor, and they blast it everywhere, and they try to make a big deal out of something that happens once every 5 years. Meanwhile, medical error is the third leading cause of death in the United States. And I know people will be in the chats and say like, oh, that those numbers are distorted. And I agree they are. I agree that it's actually not that high, and that they're dealing with much more severe cases, people that are literally dying, where we're not doing that, right? I agree with them. There's nuance to it, but don't just throw out statistics willy-nilly and expect not to catch some back. There's nuance in all these situations, and throwing out statistics out of context in order to harm other people, it doesn't do anything for the profession. It doesn't do anything for patients. Anybody who knows me, I've got over 55 patients that are medical doctors. I refer to medical doctors all the time. If I don't think that it's within my scope, or if I don't have somebody significantly better on the first or second visit, I'm going to refer them out, usually to a physician, sometimes to a physical therapist, sometimes even to a chiropractor. But the thing is like, we're all healthcare professionals. We should be referring to each other, sending patients to somebody who's the best at any given job.
Exactly.
And again, that's what's doing right by the patient and doing right by your professional ethics as well. I've like I said, you can go look at my ratings, my Google ratings and my Rate MDs. I mean, you'll see 5, 10, 15 doctors on there who have spent hours with me as patients or referring people in, who trust my knowledge of the musculoskeletal system, who trust my ethics, and have seen the outcome in my work, and do that enough to send me patients, including cardiologists, neurologists, orthopedic surgeons, spine surgeons. I mean, your PMR doctors, family doctors. I mean, you name it. We refer back and forth to each other, and it's because I am humble enough to know what my limitations is. I don't try to treat endocrine disorders or things like that. Again, I'm not taking shots at people who do nutrition or whatever. I think that my scope is I'm a musculoskeletal specialist, and that's sort of where I focus. And if other people want to focus more on wellness, I mean, all to them. But what we try to do is we try to use conservative care to help people get out of musculoskeletal pain. And if we can't, then we need to get them to the right person, because there's an answer to every single problem. And obviously, we're not the answer to every single problem. Some people are not candidates for our care. Some people are not financially going to be able to afford it. We try to make it ways around that. And some people are not going to tolerate like fascial distortion model stuff. So we're not a good fit for them. They need somebody who's doing more gentle care. So there's other chiropractors, other massage therapists that we'll refer to that, have a little bit more gentle style, that it's a better fit for those individuals. And, the name of the game, as hopefully you've been learning in clinic, is that the most important thing is getting the patient to the right person and doing right by them, and not wasting our time battling other professions or trying to prove that we're better than other people. And, like we talked about this a little bit in the clinic too, is the response bias is, you have to check yourself, because every single patient that comes to you is going to have, most of them have failed at other things, right? They're going to fail. The doctor misdiagnosed them. The PT didn't help them. Another chiropractor made them worse. The people that those people fix don't need to come to your office, right? Because they're fixed. So you're only going to see the failures of other people at your clinic. And if you're not a thoughtful and nuanced person, you're going to walk around and think that you're great and you fix everything, and everybody else sucks because you constantly get people to come from their clinics that they didn't fix. Well, here's the thing. The people you don't fix typically don't come back to you. They self-select out and go somewhere else. So you don't get to hear about your failures. It's even worse for doctors because they don't even get past the front desk staff. So, most healthcare providers never really hear about when they fail, so they don't get that feedback. So all they hear is when they do a great job. And then they hear all the failures of every other provider when they come to them and say, hey, I went to this chiropractor and he made me worse. I went to this physical therapist, he made me worse. I went to this surgeon, he made me worse. All the people that those people fix don't come to you to tell you how great that other person is. And if you're not careful, it'll bias your worldview and make you think that everybody else is terrible and that they're dangerous. And that's obviously not the case if they're still open. They're obviously doing a decent enough job to take care of people. And I think that's an inherent bias in healthcare. And we're all a little bit egotistical, right? You don't go into this field and spend hours and years and years and years studying because, you want to be average, you want to be great. And we have to be very careful to not let our egos run away with us. And we always have to ask ourselves, am I really seeing 4 or 5 of these cases this week, or do I have a bias because I've seen 1 or 2 of them Now I'm looking for that diagnosis. Now I'm looking for that problem. And try to be very real with yourself. And, it definitely helps to have other providers around to kind of check you. And I think that's something where chiropractors struggle a little bit, with many of them go into independent practice, where doctors typically have an attending for 3 or 4 years. So you have somebody around to tell you that you're dumb, your ideas aren't awesome, and it kind of keeps you in line. Now, conversely, I think it also stifles creativity. I think it stifles the creative process where you see all these physical manifestations and you can come up with newer and more interesting ways to approach them, and literally using the scientific method, right? You have a theory, you have a patient, you test it. If it works, then you see if it's reproducible, and then you see on what type of patients, and through your clinical experience, you'll know which interventions work best for which individual types of presentations, which demographics. And that's why it's called the art of medicine, or the art of chiropractic. There's science too, but there's also a lot of art and a lot of clinical experience. And unfortunately, and no offense, Doc, new practitioners don't have clinical experience to lean on. They literally only have literature. And so when you only have literature, that paints your worldview. But people don't fit into studies. There's outliers. There's people that are far on the spectrums on either direction. And we shouldn't just ignore those outliers. What we should do is come up with more specific and nuanced and patient-specific ways to approach and treat those individuals.
Do you give like talks to other doctors?
I give talks to the naturopathic students in my school, but yeah, not typically.
Interesting. I think most, if not all, I mean, not just chiropractors, but all types of doctors, I think, would benefit from what you just said. I hope other people were listening too, because you made some great points there.
Yeah, I think these are just things that people don't think about. And again, they just, after years of practice, you come across these things, and again, you're constantly questioning yourself, right? Like, okay, did what I do really help there, or were they just going to get better on their own? Or, do we have too many cooks in the kitchen? Are they seeing 3 providers, and maybe what their PT is doing is making them better, and what I'm doing is making them worse, and they're staying neutral, or vice versa, right? Like what I'm doing is making them better, and the PT they're doing is making them worse. And so sometimes it's helpful to remove ourselves and step back and say, hey, let's focus on one therapy for a few weeks, and let's see what happens, instead of trying to tell them, hey, don't go see that person, or you should only see me. Unfortunately, I think it's important to keep your overhead low so you don't have the finances making decisions for you like that too. I think we talked about this too. One of the reasons I don't have an x-ray machine in my office is I never want there to be a financial raven sitting on my shoulder, influencing, whispering in my ear what sort of clinical decision I need to make. So if I buy a $100,000 x-ray machine, I have to pay it off. So if I'm 50-50 on if I think somebody needs an x-ray, guess what? Even as ethical as you try to be, you're gonna probably lean towards, yeah, let's go ahead and get it. And I think it's important to try to separate yourself as much as possible. Obviously, we have to make rent. We have, some people have student loan repayments and things like that. That exists. You have bills. Everybody, we're in work too, right? Like we have bills just like anybody else. But as much as is humanly possible, to try to separate yourself from financial biases that would influence your clinical decision making. And I think that goes across the board. It's not just us. It's other professions, other fields. But unfortunately, in chiropractic, I think what we notice is because there's not so many salary jobs, you also sort of have to be a business person to a certain extent as well. And it's hard to be both, right? Like it's hard to be intellectually a clinician that is, up on the literature and know all the clinical stuff. Oh, and be good at business. Like those are 2 very different and distinct skill sets. And I think it's very rare that people have both of those. And I think it puts a lot of new chiros in a tough position because they're having to learn business on the fly if they don't have, family members that are in business, or they don't, you're lucky you have a business background and education. That should help you a lot. But a lot of folks don't. And, they end up either failing out of practice because they can't financially cut it, or they end up becoming unethical and seeing more patients than they should, or, getting in these car wreck, things, or they're ambulance chasing.
Yeah.
And I think, if we did a better job of integrating ourselves into the hospital system and things like that, to where there were more salary jobs, I think it would do wonders for the profession. And I think Dr. Schneider at Pittsburgh is pushing that forward in the right way, where those chiropractic students will be learning right next to physical therapy students, right next to medical students. So they'll all know what each other do. They'll know how to operate in that space. And hopefully there'll be some, attending type jobs for those graduates in the hospital there, and then that model is copied at other universities and healthcare systems to where those salary jobs exist for those of us that don't want to open our own business, because it's not for everybody.
That's true.
So you don't have to, and again, no disrespect to the joint, but they have some tough hours and things like that. And I think if you wanted a salary job, I think a lot of folks would love to work in a hospital system or work, in a family medicine system. And because those doctors and administrators don't have experience with chiropractors, they're not going to take the risk without seeing it first. And I think the University of Pittsburgh, has sort of taken the risk by adding the chiropractic program first. And I think it'll go well. And if it does, then I think other universities will jump in because they'll see how successful it is. But nobody wants to be the first one to jump off the ledge, right? They want to make sure that it's safe. They want to see everybody else do it first. So I think that's going to be, something that's going to help integrate and move the profession forward a lot. And like your school and my school to a certain extent too, is leaving some of the old ideas from the 2 centuries ago in the past. Ideas that make us incompatible with modern medicine, subluxation theory and things of that nature that are not scientifically approvable. They're not reproducible. It makes it harder to integrate when you're speaking a language that other people don't speak. So I think it's important for, chiropractors and PTs and acupuncturists and people to all speak the medical language so that when they're communicating, they know what they're saying. They're not using a language that's separate and, unrecognizable to other healthcare practitioners.
Yes, I think we should put more effort into, like you said, how we can speak the same language as opposed to like trying to create more and more separation. And kudos to University of Pittsburgh. Like you said, it's difficult being the first person to do anything. I know other accounts, and you have as well, talked about chiropractors, but sometimes I do kind of feel like I wouldn't say the only one, but at least at the rate and the volume that I've been putting out, sometimes I kind of feel like I'm by myself a little bit. And it's great that to have a little reminder like you and some other people have reached out as well that it's not necessarily the case. And back to your other point earlier with business and chiropractors, I think there is a balance between obviously making money and helping people. And I think that's where creativity comes into play, where you can get the best of both worlds. And a lot of people think it's either or, like either I help everybody and don't make any money, or I make all the money and I don't help anyone. I think there is a balance and there is a way to overlap those two circles. And the more creative you are and the more you think about it and be a little bit innovative, maybe not everyone has done some things, or some people have done it, and you can not replicate but kind of pull from that information. I think the possibilities are there to help people and make a little bit of money in the process. Just want to touch on that.
Yeah, definitely. Hey guys, make sure to go follow him right now. His ad is Chiro student Wigodsky. Am I saying that right? Wigodsky?
Yeah, you got it. That's not bad. A lot of people mess that up.
Yeah. So get him to 500 followers, and then he can start showing his face in the live.
We're working on it. We're getting there.
Everybody go over there and give him a follow. Everybody that's on the chat right now, give him a follow right now, and you guys can get him up over that 500 spot.
Thank you.
Yeah. So I kind of just wanted to jump on a live and commend you for the content you're putting out, and then like I said, the reason why I reached out before is because I don't want young providers and practitioners just getting all this negative attention and thinking that's how the world is. Like I said, you get into practice, and you probably saw with my patients, they're all very happy and grateful to be there. The coworkers are there. Like, the internet's not the real world. All these people are coming, and they're excited and they're happy and they're grateful. You probably heard some stories of, some of the patients telling you things that we've helped them with in the past, and things like that, and even the cool, like my office is in an MMA gym, right? Like, I'm in a professional sports environment. All those things exist in this field. I mean, the profession's been so good to me. Like, I've been able to, take care of my family and give a whole bunch of other people jobs who can take care of their families. And we've been able to, help people. I've had patients, one of my patients, she was actually Googling a place to buy a gun to kill herself. When she came across one of my posts, she was in such severe pain, and she decided to book an appointment. And we came in, and after 2 or 3 visits, her pain went from about a 10 to like a 3.5 or a 4.
Wow.
And this is a lawyer, a retired lawyer. a very intelligent person, but they were at their wits' end. They felt like all their doctors were dismissing them. They didn't have any answers for them, and she just appreciated that we spent an hour listening to her and listening to her needs and trying to help her and teach her home exercises and things of that nature. I could even count at this point thousands of people who have been recommended unnecessary surgery that we've been able to get them out of pain to where they didn't have to have surgery, or at least delay surgery until they can get their lives in order and together. Because not everybody financially or with their life can just jump under the knife next week and go through the recovery. A lot of people have to save for a year or two and request paid time off and, get somebody to help them with their kids or things of that nature. That's a win too. If you can help somebody delay that procedure, as long as it's not causing damage in the long term, to get their life in order. If we can get people, not taking as many opioids, obviously that's a win. If we can get people not taking as much Tylenol or acetaminophen, or NSAIDs, all those things carry a significantly higher day-to-day risk than chiropractic manipulation does.
A lot of people don't think that.
Yeah, like 25,000 people a year die from liver failure due to acetaminophen use. And what a lot of people don't realize is the non-steroidal anti-inflammatory drugs. So say your ibuprofen, I'm not sure I would classify aspirin in the same category, but it does have other deleterious effects sometimes. Aleve, some of the more advanced ones like Celebrex and things, the old Vioxx, many of them have a serious increased risk of stroke in particular, but also heart attack. Aside from, kidney damage and stomach damage and things of that nature too. So, just because you can get it over the counter doesn't mean that it's inherently safe. And like we've talked about, there are adverse events that do happen with chiropractic sometimes, but, we have to go off of the data and, studies have been coming out, million patient studies year after year after year. We've been studying this stuff for 15 years, and there's just the preponderance of evidence doesn't show that there's any increased risk. That doesn't mean that it can't happen. It obviously does happen sometimes, but the risk isn't higher than going to the family doctor or going to the physical therapist. And I think contextualizing that risk is very important for patients and for providers too, to where we're not misleading people with data that doesn't actually exist. They're actually looking at the real data and contextualizing it, and comparing that to the background data as well, about the relative safety of these treatments. And again, there are known contraindications. Obviously, we think that may be the biggest reason why we see adverse events is providers are not slowing down and looking for contraindications and doing a thorough enough examination. And if they do that, they're going to catch most of those things before they progress. But of course, because we're the redheaded stepchildren of the healthcare profession, anytime anything happens, the mainstream media piles on, makes a huge deal out of it. Doctors have realized that they get the most views on their videos when they trash chiropractors. If you look at most of the doctors out there, their highest viewed videos are typically attacking chiropractors because it's a controversial thing. In the comment section, you'll have all these people that have had fantastic results with the chiropractors defending chiropractic. And then you'll have a bunch of people that either hate chiropractic or have had adverse events, battling that out. So they get fantastic engagement, which they don't get when they just put their normal content. So again, the algorithm is incentivized that sort of hatred and controversy, in the same way that it helps us from a visceral perspective, like, go viral, I guess.
Yeah, people, it is, I would say, arguably easier to quote unquote go viral if you are being negative or trying to discredit somebody or shame somebody or whatever, anything negative related. But easier, another thing that I realized recently is even if people do make a bunch of videos that do become popular that are negative, the people that like are drawn to that, like, those aren't people that would even want, like, by myself, if that, I don't know if I make any sense, but the people that are attracted to that or that go to that, like, whatever they build up, whatever, how many numbers that is, like, those are people that I wouldn't want being around me anyway. So like the numbers do kind of show like, oh, those are kind of large, but it's not really like, it's not enhancing their life. If anything, it's like bringing negative people that I don't know how that benefits either their life or their business or whatever, but like the numbers are cool, but doesn't seem worth it to me because as we've touched on, there are opportunities I could do what they do, but that's just not my style, and that's not doesn't seem worth it to me. Even
Yeah, it's destructive. I don't engage in it either. I never have. When people make critical videos of me, I don't respond back to them. I just ignore them. Like it is what's going to be. And if you're big enough, you're going to be a target. Yeah, it's my friend Ronnie Chang has a saying. He's like, don't be a person that criticizes more than you create. Anybody can criticize, but it takes a very powerful person to create something new or to risk doing something like that. So anybody can make a video responding to other people's content and attacking them or whatever. But it's lazy. It's not, and they'll hide behind the veneer of saying, "Oh, we're protecting people" or whatever. No, you're not. You're just intellectually masturbating while trying to gather followers and hating on people that you think are doing better than you.
yeah.
And the thing about that kind of critical content, and I think people in the higher ends of academia, particularly MDs and PhDs, I really think that there's a feeling, particularly when people with lower quote unquote degrees than them are getting more attention and views. There's a personality type that drove them. Like, if you didn't know, like, for example, neurosurgery and plastic surgery are like the hardest specialties to match out of medical school. So you're talking about like the top 0.1% get into medical school. And then the top 1% of those are the people that match into those specialties. Like, they're incredibly competitive. Like, these are actually brilliant people, but they're so insecure that they need to take the time and go attack other people. And like I said, they'll hide behind the veneer of protecting people or whatever, but we know that's not what they're really doing. What they're really doing is putting people, quote unquote, into their place because they feel like they've worked so hard to get to their position. They can't fathom or understand that somebody from a lower profession would be getting attention or people would be paying attention to them. And I think it drives people like that crazy. They're like, I did everything I was supposed to. I played by the book. I did this and that and the other. So everybody should be worshiping me and telling me how great I am. And next thing you know, this chiropractor or this acupuncturist or this physical therapist is over here getting all these millions of views and this attention. And it really, I think, grinds their gears. I think it drives them crazy. And a lot of them, they can't even film their content, right? Like, we just happen to be in a profession where the content is very filmable and it's got an ASMR, component to it. I think Dr. Pimple Popper, happens to be in dermatology, and she was in a profession that's very visual as well. But you can't show spinal surgeries on the internet, right? Like, it's too gory. It'll get demonetized. It'll get suppressed. You can't show internal medicine prescriptions. Those are fields that you can never really go viral with. So your content itself can't speak for itself. Your testimonials can't speak for itself. So how else are you going to get the attention that you feel you deserve? Well, one of the ways they do it is by attacking other people. And it's just really low frequency stuff. It's really embarrassing, the fact that they don't think that other people can see through it and understand what they're doing. And like I said, like, they'll hide behind the veneer saying, oh no, we're looking for the truth or for patient safety. But we all know what they're looking for is views and they're looking for the same sort of pat on the back that they got when they got into the top 10 medical school or when they matched into the competitive specialty. It's the type of person that's always competitive and always looking for that top notch, and they can't stand anybody else competing or coming around them, so they have to beat everybody down. It's like whack-a-mole. And that's the type of people that stitch your videos and attack you and call you dangerous when you've literally said nothing but facts. You haven't given any medical advice. You haven't given any information. All you're doing is letting patients know what the educational requirements for doctors of chiropractic is. Because like you said, I don't think a lot of people realize that. People think you go to a strip mall or, you get a weekend course or something. I wish I wouldn't have wasted 3.5 years,
yeah. That's a
grad
popular
school.
one, the strip mall one. I don't know why, but I've got hundreds of those.
Yeah.
But I think it's so weird that, especially like the first one, and still, you have these very, very comparatively more popular people talking about me for some reason. I no way, shape, or form compete with their channels whatsoever, and like they're I guess picking on or just mentioning just someone with virtually no following compared to theirs, and not even like working as a professional and still as a student. It's just so weird. Like, they're older than me, but they act like children. It's very strange.
Right. And like you said, they're rage baiting, right? Like, they're doing the exact same thing they're accusing you of. And it's because that's the only content that actually gets engagement on their pages. So the same reason that girls all learn to stick their butts out for their selfie pictures, and guys, post the pictures of them lifting weights. It's a learned operative, conditioning thing that the content that gets you the most likes and the most engagement, your brain as a human learns pretty quick that this is more of the content that I need to do. Look, I'm no different either, right? Like I used to put more nuanced like lectures on my YouTube channel, very like in-depth biomechanical assessment stuff from what I was teaching, and it didn't get any views, right? But if I cracked a strongman, or I cracked a UFC fighter, or I cracked a fitness model or something, 5 million views. So guess what? The incentives drive the behavior, and that's just human nature. So unfortunately, when your field, the typical content they put isn't getting the views, they know they can always go back to attacking the chiro student, and it's going to get a ton of engagement and a ton of likes and a bunch of hate comments as well, because there's going to be people defending the chiropractors. And that's the incentive, right? Like that's the incentive. And it, like you said, it's really pathetic because, the one guy was like a 6th or 7th year neurosurgery resident. Again, you're the king of the castle at the hospital, but you're taking your time to go attack, not even a chiropractor, but a chiropractic student, talking about punching down. Like it's bullying, it's embarrassing. And it's not factual. You're taking what you're saying out of context to make it sound like you're saying something that you aren't. The definition of straw man, right? We put up the straw man and beat it up and pretend it's the person that we're beating up. But if anybody actually went back and actually watched the videos and listened objectively, they know that's not what you're saying. You're being very specific, but they're all going to gaslight you and try to make it sound like you're saying something that you weren't saying. And that's crazy.
Yeah. Shout out to all the people that actually care about finding out the underlying information, not just looking at the headlines. Not only will you eventually, if not already, find out the truth, but I think that if you're that type of person that actually looks into things and not just listen to what you're told by a select group of people, then I think you'll be overall just happier and just live a better quality of life if you actually pay attention and not just look at the headlines and dive into what is actually out there. And yeah, I just wanted to say that.
Yeah, cool. I think we touched on about everything. We've been going for about an hour, I think. So we have like 3,300 hearts. So thanks to everybody that gave us the hearts.
Oh, really?
Yeah. You want to do some questions? I don't know if we have any questions in the chat.
Let me see. I didn't want to read too much while you were talking because it's distracting, but I saw a couple of them. Most of them are for you, though, I think. Let's see. Oh, New Zealand. That's awesome. Chicago. Is that Arabic? I don't even know what that means.
There's a question there. What school did you go to? Doc went to what is it now? It used to be LACC when I was around. What's it called now? Southern University.
Oh, SCU, Southern California University.
And I went to Parker University, formerly Parker Chiropractic College.
Nice.
And my buddy Dr. Andy Galpin, if you guys are wellness consumers, he has a podcast with Andrew Huberman. He just left Cal State Fullerton. He's a PhD in exercise physiology. He's going to be the head of the Parker University exercise physiology department now. So he's going to be teaching at a chiropractic school. Super smart guy. He's a steal of a person. Wellness Way went to Northwestern Health Science. That's a pretty science-based school too, I think. That's the one in Minnesota, I think, right?
Doc, if you're finished answering that question, there's another one for you. How difficult was it to open your own business doing chiropractic from Rehabilitation Sam?
That's a hard question to answer because, I built a lot of practices working for a larger corporation previously.
Right.
I think things are going to be harder right now than they were when I started, which was I opened my practice. I got licensed in 2010, so I've been doing this almost 15 years. My practice in Albuquerque I opened in like late 2012. So the economy was obviously very different at the time. Rents were much cheaper. Equipment was much cheaper. But like I told Doc, one of the main things for me is just to keep my overhead extremely low starting out. And I never had to go any business debt for it. So within probably 7 months of being open, I was completely booked full and couldn't take any new clients. And so that's when I started hiring colleagues and filling up their schedule and taking a small percentage of the revenue that they're generating as well. So I went from just myself to four of us in like a year and a half, maybe. We've been open for 12 years now, and there's 14 of us.
Nice. Very
So
nice.
I'm a slow grower. Like I don't want to onboard more than one or two people a year because I want to spend a lot of time training with them, teaching the culture of our businesses and things of that nature. Could I have grown to 50 or 100 providers by now? Yeah, I'm sure I could have, but I just think the quality drop off would have been drastic. And so, we're a slow growing company. And I'm really looking for personality types more than anything. I think I could treat anybody to treat, but I can't teach people how to be a caring individual, somebody who listens, somebody who wants to help people, somebody who's friendly. I think those are things that are a lot more important than a practitioner. I think almost anybody can learn facts. Even somebody who's not as smart can learn them. It just takes more time, but they can learn them. But it's very hard to teach character, ethics, and personality.
That's great advice for, I think, any business owner. That's awesome. Definitely things to consider. And I know, I got a little bit of treatment while I was there, and even not from necessarily someone with a doctorate degree, was very good. How do I describe this? It was not that I had any type of expectations, but I was very, very pleased with the results that I got. I didn't have anything super wrong with me. It was more of a little checkup, but you clearly have that quality at your office. And I'm sure everyone else that I didn't have the opportunity to spend a lot of time with has that same quality, because just the way that they've talked. So, you say you go to slowly. I think 14 people is huge. I wouldn't necessarily downplay that. I know most people couldn't even get there if they tried, but I know you're super popular in a special case. But that's good. I didn't know you made that intentional decision. That's awesome.
Yeah, and people have asked me hey, do you want to do teach weekend seminars with some of the techniques that you do? And I could make a ton of money, obviously, doing that.
Yeah.
But same thing. I feel like I'd be doing more harm than good by giving somebody 2 days worth of teaching. I think that would just give them enough confidence to be more dangerous, as opposed to spending weeks and months, training alongside me, learning the layers of kind of the way we treat and things like that. So, does it cost me money in the long term? Of course it does. But I would rather have that on my conscience, and you can still make money in other ways, I think. And luckily, like I said, I've been be able to make a lot of money on social media, just right place, right time. That takes a lot of pressure off of your brick and mortar business. So I'm definitely lucky and blessed in that way.
Oh yeah, you're an amazing example of different opportunities can come in if you explore the online aspect. And I've told you this already, but for the people listening, have been a great example to me and so many other people. You see, a lot of my old classmates want to do ideally what what you've done, and I try to be a little bit different, not necessarily because it's bad, but because I know it's been done before. I don't just want to rinse and repeat, and you're the man for that. And I don't want to encroach anything in that way, but you have been a great example of what things can turn into, and the different opportunities and the different people that you get to meet. So I would argue most people, if not everyone, would love to be in your position. So you're the man.
I appreciate that, man. Hey, did you? I saw that you met CT Fletcher. Did you ever see the workout that I did with him?
I did, dude. Oh my God, that was
He killed my triceps.
Yeah, you did the gauntlet, right?
Yeah.
Yeah. I didn't use those weights, but I've done the gauntlet with much lower weights. CT is awesome.
I didn't even know what it was. He's like, "You do the gauntlet." I'm like, "Okay, I guess I'm doing the gauntlet."
Yeah. Yeah, he's crazy in a good way. I love CT. I got to
It's
meet him
still
and
your set.
yeah. Back when I was like first getting into YouTube, YouTube is kind of like my form of entertainment. Like I don't really watch a lot of TV or movies. Like I'll watch with the family now that I'm home, but I didn't even have a TV when I was at school. So YouTube has been like how I get information, how I get entertainment. And he was one of like the big YouTubers I saw. And I mean, you were as well. You're a different category than him. You're more like obviously healthcare related. He was more like workout related. And like when I go to
Yeah.
the gym, he was one of like the main guys that I really watched. Love him, and I got to meet him, which was awesome. I even like he's the book that I wrote about working out and mentality inside and out of the gym. Like I quote him so many times, and I list him in my acknowledgments, and it was like a surreal experience to meet him and give him a copy. And honestly, it was with you too. Like it, different topic and different scenario, but like meeting people that like you look up to or just watch consume so many hours of their content is it's a great feeling. I don't know. I guess you've probably, if I'm assuming, been starstruck by people, but you're one of those people for me.
I appreciate that. Yeah, I don't know what it is. I mean, I don't really think I've really had that
Oh, really?
experience. Yeah, I don't know. People ask me that a lot. I'm like, I don't think I have. I mean, there's been moments where it's like, oh, this is cool. Where it's like people that I grew up watching. So for me, like a good example of that would be like Evander Holyfield, right? Like where as a little kid,
Mm.
my whole family would get the pay per view, whatever. Um, and maybe because it was a gradual thing for me, like I was working with UFC champions within like a year of graduating Cairo school. So, um, so
That's crazy.
just working with a lot of like pro athletes, right? So then it's not a jump straight from like regular people to like world champion. It's like I've traveled with Diego Sanchez and Alistair Overeem and Holly Holm and these people to UFC fights. So then when you meet like Roy Jones or somebody like that, they're like maybe a little bit higher up in my echelon, but they're not that much different. So you're just kind of used to dealing with it, right? I've traveled with John Jones to like 8 UFC championship fights.
Oh my
Um,
God.
I've worked with probably 22 UFC champions in my career. Probably another
Wow.
10 boxing world champions. Eight or nine UFC, or excuse me, Olympic gold medalists. Over a dozen NFL players. Probably half a dozen NBA players. Um, lots and lots of movie stars. Unfortunately, we talked about this a little. When they're that famous, they don't want to take pictures. They don't want to do videos. So I can't really disclose those folks. But
Hmm.
like a lot of the pro wrestlers, the fighters, they're used to to kind of doing social media and stuff. So they're a lot more grateful for that, and they're more likely to bring me on board and kind of give me. And I think I told you this too. Like I built my social media, off of the backs of a lot of MMA fighters and UFC fighters. And transitioned over time. It was all fighters, and then I did a lot of wrestlers, and just like crossover people across different platforms, musicians. Yeah, and like I said, there's cool social perks too. Like I just had backstage passes at the Kane Brown concert last week, so that was pretty fun. I've had backstage
Awesome.
passes at Kiss, Marilyn Manson, Ludacris, A Perfect Circle, Linkin Park, of Mice and Men. So I've been able to kind of work with a lot of cool artists and like getting the social perks of getting front row tickets and same with WWE events. I always get front row tickets. I've sat in the front row at like probably 20 UFC championship fights.
Oh my God, that's awesome.
So when people bash on chiropractic, I'm like, I don't know. Does your job allow you to get backstage passes at Kane Brown concerts? Does your job get you front row tickets at wrestling events? Because mine does. I'm able to make people's lives immediately better, and there's some really cool social perks that can come out of it as well. And I didn't have to sit in residency for 6 years. I got to go to work right away, helping people, and yeah, it's been as many criticisms as of course as we can always have for our own profession and ways that it can improve. I'll always be forever grateful for the profession for setting me up for success in my life and giving me so many like amazing life experiences, meeting just really interesting, cool people, just across the board, whether it's, you said CT Fletcher, Cali Muscle, Ed Cohn, to working with world champions, to going with training camp with them, grappling with some of them, getting pro wrestling moves put on you by world champion pro wrestlers. I mean, there's just so many cool life experiences that I've been able to experience just due to the field of chiropractic that, you'll never hear me just blanketly attack, chiropractic or chiropractors. I'll be forever grateful to the field and the profession. Now, that doesn't mean that I won't have tough love for it sometimes, and I won't have opinions that, want to push the profession forward in the right direction, and wanting to have those kind of nuanced conversations, which I think is ironic because a lot of people that consume my content probably just think that I'm a meathead with a hammer. Because they don't see maybe the academic side of me very often, because that's not what does well in my content. But anybody who's probably spent more than an hour with me probably realizes there's a little bit more depth to me than just that.
Yeah, I mean, I didn't assume you were necessarily a meathead, but I didn't know like not only the depths, but like the variety of topics that you knew. I thought that was very surprising. I was like, either he's shy, maybe, or he just doesn't want to talk about it. I didn't know either way, but I was like, oh, this guy's one of the smartest people I've probably ever met. Interesting.
Yeah. The thing is like, if you're a public figure, the public perceives you in a certain sense, right? So they want you to go in your box. And if you ever try to move out of that box, they'll smash you right back into it. Shut up, just dribble the basketball, blah, 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 blah. We don't want to hear your political opinions. Just shut up and crack backs, or things of that nature. Mm-hmm. And, with your own livelihood on the line, it's like, okay, I guess I'll be the guy that always wears black scrubs and has a really long beard and carries a red hammer around and has his little catchphrase, "Are you into thumb stuff? Sell crack on the internet, yada, yada, yada." I'll dance like a monkey because that's what pays the bills. Like I said, 8 or 9 years ago, I used to post my, kind of when Jordan Peterson was doing that, I would post my lectures live for 3 hours. I would teach a 3-hour lecture to doctoral students. And the people that actually watched it would love it, but the numbers were so low. It's just like, why am I wasting my time? And like I said, I could do a video with John Jones kicking me in the leg and it's going to get 3 million views and I'm going to make $9,000 out of it,
I mean, those are awesome. And it is up to you because you have all the knowledge and abilities, but I would love stuff like that. But I understand exactly where you're coming from.
We're just talking about like big picture stuff. We're not talking about like getting into the nitty gritty and talking about percentiles and p-values and like extracting the data and talking about what that actually means. Like what is a full thickness rotator cuff tear? What does that mean? What percentage of it? And how many of them are asymptomatic in MRIs? And then what are the orthopedic tests that will help you to dictate which direction you should go or not go? When is it necessary to do regenerative treatment? Like at what stage post-surgical should you be doing soft tissue? Like how much remodeling of connective tissue is there at 6 weeks, at 12 weeks, at 6 months, at 12 months? That's the kind of stuff that I would talk about in my lectures. And again, the people that watched it really appreciated it, but unfortunately the numbers weren't really there. So, my time is limited just like everybody else's. And, just like the rage baiters are, I'm the crack baiter, I guess.
No, I wouldn't say that. You do provide, if nothing else, like besides like treatment that one, other chiropractors can observe whether you film the entire visit or not, or two, if nothing else, it's getting to know at least the patient that many people may know of but never actually had the opportunity to have like a more personal conversation. That another one, and then you drop nuggets here and there. I mean, I know like probably 90+% of people are not interested in the stuff that you just mentioned, but the few that are would obviously love that. But yeah, I don't think you give yourself all that credit all the time. I think you make great content. I appreciate it.
I appreciate that. It's kind of lazy content. I can't lie. Here's something that a lot of folks don't know either. Like, we intentionally hide all the stuff that actually fixes people. So like, we intentionally don't show the contact points for the things that actually fix people, whether with the hammer or with the soft tissue stuff, So if you're trying to just copy my treatment based on the videos, it's a really bad idea because like we because from early on, obviously I had a treatment style that was a little bit unique,
Hmm.
and we protect that. It's what gives us a competitive advantage over other providers. And while the money came in from social media, the last thing I would want to do is just give away all the things that I spent all the years on, and disadvantage my own providers by basically gifting, the pressure, the contact points, all those things to everybody else. So I know people have gone out there and thought that they were just doing the same things from the video, and that was going to fix the problem that they saw get fixed in the video. But we intentionally cut all that stuff out and took the camera away from the contact points. So hopefully you guys aren't just mimicking what you think you should, because it's not going to give you the outcomes that you think it is. And maybe people try to do it, and it doesn't work, and they're like, "Oh, I knew this was made up fake baloney." And like I said, it's because I used to just post the before and the afters. I didn't even show any of the treatments when I first started posting on social media. Like, it would be somebody's shoulder that could only go to here, and then I would put like an explosion, and then it would be like, oh, all the way up to here. And then people would accuse me of having paid actors, of course. So
Wow.
we do show some of the treatment stuff, but the real good stuff is not really in the videos. Fortunately or unfortunately, whatever you think.
Mm. Yeah, which is why, I mean, I didn't see hundreds of patients. I mean, I saw a few patients when I was with you, and it was really, really cool to see everything in person, the complete visit, from the walk to the door to the conversation that had nothing to do with the treatment, to the treatment conversations, to everything. So that was an awesome opportunity. And for school, we had to observe doctors in order to graduate for however many hundreds or thousands of hours. But watching, like, you in particular, and the way you interacted, in the way that you were able to treat, obviously it wasn't everything you knew, but seeing the full thing start to finish a few times was really, really cool. And thank you again for inviting me and the opportunity to come out there, because you definitely didn't have to. And it was one of the best, probably the best experience I had while in chiropractic school. So thank you.
That's awesome, of course. And Jessica, yeah, we love massage therapists. Like, you guys are fantastic. You do great work.
Are there any more questions that we missed?
Guys, make sure to go follow him so he can get to 500. So the next time we do this, he can actually show his face.
That would be awesome. Yeah, maybe that's why, because I don't know, some type of setting, or this is my first time too.
Yeah, we don't know what we're doing. So sorry, guys, if this is.
We got the audio at least.
Yeah. Yeah, we don't really know what we're doing. I have some weird filter on. It's giving me like pink rosy cheeks and like lipstick. I look like I just came out of a cold winter day sitting by the fire.
Yeah, and how's the heat over there? Is it hot for you or no?
It's the fall has actually showed up finally. It's like 86 finally. It had been 100 for several days in a row.
Ooh.
Yeah, it had been toasty. It's been a long summer. John, thank you for the badge. And Joycey, thank you for the badge. I don't know what badges are, but thank you.
I was just about to ask you, what does that stuff mean?
I don't know.
I'll Google it after this.
Yeah.
That's hilarious. I wonder if
Trucks and Piano. Oh, Trucks and Piano? Did you see our Volvo series? I've been on Volvo's ass to actually do it. Like, we shot a commercial where we brought a bunch of truckers out, and we hollowed out a big rig and put air conditioning in it and put a chiro table, and we had all these chiropractors come to a truck stop, and we treated them all. It was for a Volvo commercial. It was the same guys that did the Jean-Claude Van Damme commercial. But I was like, guys, we should literally do this. Like, we should just get in it and go from state to state. The only problem with that as chiropractors is we're licensed by the state. And so we'd have to have our license in every single state that we went to, and that would be kind of a problem. So I would like to make that happen. I just don't know how we would be able to pull that off. As far the only organization that you can just sort of skip the state licensure is the VA hospital. Like, you can, if you're licensed in the VA, you can go to any VA hospital and see a chiropractor, but like, we can't go to like Doc's going to be licensed in Virginia. I'm licensed in Nevada, New Mexico, and Florida. and I've been licensed in Kentucky and Ohio and Illinois and Texas, but I don't maintain my license in those states because it's like $1,000 a year to relicense it. In fact, I have two licenses in New Mexico. I'm a licensed naturopath and I'm a licensed chiropractor.
Oh no,
Um,
wait, Virginia's not that bad. I was just looking through the price. I think it's like I, I don't want to misquote it. I want to say every 2 years it's like 5 to 600. It's not that bad
yeah,
comparatively.
we should have to do 500 a year for each license.
Okay. Yeah, I think it's biannually for us. I gotta look into that. Thank God. I mean, I was expecting to have a jurisprudence test for my state, but I still want to study as if I do have that test because
Yeah.
it's a need to know need to know basis. I didn't know Virginia was
Florida
so
has a
different.
pretty rigid licensing exam.
Oh, really?
You have to go to a Prometric Center and take a full-on exam through the NBME or NBCE.
Oh no way! I took Prometric for my national boards.
Right. So I'm so old. We used to have to go. They would only do them 3 times a year, and you'd have to show up on campus. You'd have to have nothing on you. You couldn't bring a key fob in. Um, you'd have to. You wouldn't be allowed to bring a pencil in. You'd have to go in there, and they'd separate you. You'd have people watching you, and then you'd get a Scantron test. Um, so we couldn't take them wherever we wanted to. You'd have to travel to a Cairo school for your national boards, and then you'd have to sit there and stand in the hallway, and they'd pat you down, go through a metal detector, all that fun stuff
For all of them or just part four?
for all of them.
Oh no way! Yeah, we have to
Yep.
do that for part four, but that's funny. No, we just could show up to the computer lab and do our thing.
Yeah. Yeah. So Jessica, we have board examinations that are nationwide, but they're not technically board certifications. Um, so we have 4 national board exams. So the part one is your basic sciences like biochemistry, microbiology, anatomy, all those things. Part two and part three are more clinical based. They're clinical vignettes. Radiology in particular, there's a lot of radiological cases where you're having to look for like bone cancer, bone tumor cysts, soft tissue pathology, and things like that. And then part four is with fake patients. So you have to go in there and you'll get a case and you have to do a full exam on them. You have to listen to heart sounds. You have to check all their vitals and things of that nature. And then you're graded on how well you do those things. Not only procedurally, but also on getting the right diagnosis and then what your recommendations would be. And then we have secondary board certification. So if you do a 3-year postdoctoral program like I did in neurology, you'll have an 8-hour exam. It's like 300 and something questions with their multiple choice. And then we also have to travel to a location, do a practical examination, which is sort of similar to part four, just a lot more advanced, where you have to do a full neurological workup on somebody, and they'll give you a case exam, and then you have to tell them, what you would do to treat it, who you would refer to, what neurological examinations you would order. So say you would order like a needle EMG or, an MRI of the brain or CT of the brain and who to refer to. And so, like when I just did it, my practical for so now I'm a board certified, quote unquote, chiropractic neurologist, but you're in a little tiny room. You have two proctors who are grading you. You have somebody in there with a video camera grading you. Then you have a dummy patient who doesn't know what they're doing, all in this little tiny exam room. And then you're obviously nervous, and you're trying to get through everything and do all the exams and do all your cerebellar tests and your basal ganglionic tests and stuff like that, and while not tripping and falling. And so yeah, it's pretty intense. Yeah, it's objectively like we were talking about earlier on in this discussion. It's not quite as hard as medical school, but it's harder than almost anything else out there.
Right, like I didn't. Oh my God, it's completely different level than undergrad. I didn't know what to expect. I heard just from other students when I visited other schools, like, oh yeah, you gotta study a lot. I was like, yeah, I took like 5 classes at once. I know what studying is like. Oh my God, it's nothing like undergrad. And it's hard to compare if you've never experienced it.
Yeah, it's hardcore. Like I said, when I was in school, we were supposed to be in an accelerated program, and they actually de-accelerated it because people were having a hard time with the course load. It was just too much to throw at them for some of the courses that they needed to pull it back to like 24, 25 hours a week. of lecture credits. Where it's pretty common in undergrad to take 15 hours. You know, if you're really hardcore, you could do 18 or 21. But basically, every semester of chiropractic is minimum like 22.
Yeah, we
And
were
we're out of
approaching
school.
30.
Yeah, 28, 30 was pretty typical. So you have class, you have lecture. So when I was in school, we had lecture class from either 7 or 8 a.m. till noon straight, and then we would have typically labs, but sometimes lecture from 1 to 3 or 1 to 5 every day. So it was pretty consistently 7 to 5 every day, except for Fridays. Yeah, sometimes we'd get out at like 1. Um,
Nice. Yeah, we were like 8 to 5. They didn't split it up, lecture and lab like that. It was kind of like mixed. I think your way was a little more organized, but my school was a little bit thrown off with COVID because I don't know if I'm supposed to say that on live, but we could only do lectures the first 2 semesters because that was in the end of 2020, and
oh
then
yeah, they
yeah, and
want you
so
guys in the same room or whatever.
and then we had to do like groups, and so we can only work with like 5 people like the entire semester. That was who like you tested with, that was who you practiced with. And so it was a little limited, but then I want to say, because I was in Cali, so maybe like end of 2021, beginning of 2022, we could work with everybody, and then we went from like super lecture heavy to a little bit more lab heavy to like balance it out. But ours was like a
Yeah,
unique schedule. I was one of the very, very few classes that couldn't work with cadavers because of the vid or whatever.
yeah, yeah. That was it was useful for me. I mean, we obviously had that class where I think we did 2 cadavers, where we cut open the body all the way down. And I was a TA in cadaver lab for 2 semesters as well to try to get a better mastery of it. And what's crazy is like there are actually med schools that don't actually have cadavers. They just do they have a pro section table where you just kind of like do digital versions. Um, which is a little wild considering like they actually all are capable of performing surgery. I guess they get the actual experience in clinicals. They're actually doing the procedures, but it seems like using cadavers would be a good practice run. Where for us it helps us to understand it, but cutting open the body is not within our scope in most states.
Hmm.
Um, One sec, I actually think I have my course load here. 'Cause I think I
No
have
way.
my transcript.
No way.
Yeah, I might have it.
Nice. Yeah, I think my school just sent mine to the board, I think literally a couple of hours ago. So hopefully I'll get to. I don't know if it even passes my hands on it. I think they send like through an email directly, but maybe one day I'll get my transcript. I have the unofficial one on my computer.
All right, let's see if I have it here. Yep. All right, so you guys want to know what kind of courses chiropractors take? So first semester we had human embryology, we had systemic anatomy with a lab, we had clinical concepts 1, we had business principles 1, we had clinic 1 practicum, we had research methods, we had chiropractic principles and philosophy with a lab, we had biology of cells and tissues, and then biology of cells and tissues lab, and then fundamentals of diagnostic imaging and fundamentals of diagnostic imaging lab for a grand total of 28 hours. That's first
That
try.
was your first semester?
Yeah. And then try 2. It's weird how it says honor roll on one of them and then dean's list on the other one.
Hey, I think Dean's List is at least 3.5, right?
Yeah. I mean, I was pretty much always on that, but I'm just reading this now, and when it says honor roll for 3.64 and then dean's list for 3.67, which, I don't know, maybe they just changed the wording on it. My second semester is gross anatomy 1 with a lab, clinical concepts 2, palpation skeletal analysis with a lab, clinic 2 practicum with a lab, clinical biomechanics, microbiology with a lab, human physiology 1, biochemistry 1, normal radiographic anatomy, and that had a lab. So that's 29 hours. Try 3, we had gross anatomy 2 with a lab, extraspinal analysis and technique with a lab, diversified technique with a lab, clinical documentation, clinical practicum 3 with a lab, chiropractic principles and philosophy 2. We had public health and immunology, human physiology 2 with a lab, and physio 2 was like cardiology, essentially, like doing EKGs, knowing what T waves and all that kind of stuff is. A lot of exercise phys. And then try 4, we had human neuroscience 2, Gonstead lab, clinic practicum 4. And the previous semester was 27 hours. Physical diagnosis lab. So that's where you're doing, checking eyes, ears, throat, all that kind of stuff, listening to heart sounds. We had clinical orthopedics lab, pathology 1, biochemistry 2, human physiology 3 with a lab. So if you guys have been an undergrad, you're taking pathology, biochemistry 2, physiology 3, human neuroscience 2, clinical orthopedics, and physical diagnosis all in the same semester. And then you go to try 5. We had bone pathology. We got clinical neurology. We got dermatology. We have lab diagnosis. We have clinical neurology with a lab. Clinical procedures. Thompson technique. Wellness concepts. Lab diagnosis. Functional assessment protocols. And then try 6. You got physiotherapy. You got communications lab. Activator, which is a lame technique. Business principles 2. This was like the easy semester. Communications, bone pathology 2, bone pathology lab, emergency care lab. So that's where you learn like PCR, airway clearance, all that kind of stuff. Bone path 2 and emergency care. So that was 29 hours. That was probably the easiest semester. And then we still had 29 hours in try 7, which is when we were in the clinic. So we were already in outpatient clinic, and I still had 27 hours of actual classroom work. So soft tissue pathology, grand round labs, clinical nutrition, clinical psychology, differential diagnosis and case studies, soft tissue pathology, sacrooccipital technique. And then try 8 is where we finally start paring down the academic course load. So my second to last semester, where I was fully in the clinic with patients, I still had 21 hours of lecture class.
Oh my God.
Pediatrics, geriatrics, OBGYN, legal aspects of chiropractic, applied kinesiology, grand round labs, radiological examination technique lab, case management 2, rad exam technique. And then try 9, we had no lecture classes. We had only clinic. So when he's talking about the preclinical hours, and I was talking about this with a neurologist too, is in med school, you have 2 years essentially of lecture classes and then 2 years, a year and a half of clinicals. So you don't have any lecture classes during your clinicals. But in chiro school, I had lectures in 8 of my 9 trimesters. So yeah, I did a full year of clinic, but 2 of those 3 semesters, I still had 20 hours of lecture classes too. So I only had 1 trimester essentially where I wasn't also in lecture. Now, I think that made our clinical experience somewhat lacking in my opinion. So I actually went to Columbia for my try 9 and worked with their Olympic team. But it was really hard to get your clinical hours and your patient numbers because you were still having to, I took lecture class seriously. So I still wanted to get A's and B's in those classes. So, when you're in 27 hours, 21 hours of lecture class a week, and then you're still trying to find time to get in the clinic and see patients and get your numbers, it's really hard. And I think as a byproduct, I do think there's more didactic hours, and I think it's probably unnecessary, to be honest. And I think the PIT program will bear that out, that you don't need that many lecture hours, and we do need more clinical experience. And I think the medical school's clinical experience is light years ahead of chiropractic school's clinical experience. But technically speaking, I think there's more lecture hours and lecture classes in chiro school than medical school. And again, I'm not to diminish medical school or compare the two, but what you said is technically correct.
Yeah. That's interesting. So you did 9 trimesters?
Yeah.
Oh my God. Okay, so perspective for anybody else, I had 12. So I had an extra year to do what he did. My school does offer 10, but I don't think they do the 9. 9 is crazy.
Yeah, we went straight through 3 years straight, no break.
Oh God. Yeah, I had a 4th year, but I guess it was a little bit more spread out. Our entire final year, our 9th semester we had classes plus clinic, but because mine was a little bit more spread out, I had a year of just clinic. But I believe the 10 trackers, kind of similar to you, there's only 1, maybe 2 that was purely clinic. And my school had the opportunity, which I took advantage of, to do extra clinic hours in exchange for credits. Um, so I did like an extra 100 hours every semester that
Mm.
my classmates, most of them didn't do because they took like electives, I think, what other schools call it. We call it selectives. I don't know why, but they took like weekend, like 1 credit classes, and I was like, I don't want to just sit at home on my weekends all day long, Saturday and Sunday. I'd rather like be in an office and actually treat. So I didn't have
Right.
like an exponentially higher amount of hours, but I did probably wind up having like 500 or 600 more than most others. But yeah, I think you're right. More clinic hours would be awesome, because if you were to do like the absolute minimum, like it wasn't even like a full-time thing. Mine was more full-time because I chose to do extra hours, but like the average Cairo student, it wasn't a full-time like 40-hour clinic weeks.
Yeah. And like I said, for me, it wasn't even possible except for the last trimester because like you have all those hours of class.
Yeah.
And so, I mean, I chose that school. That I think we're the last semester, the last one. Now that they do 10 trimesters is the fastest you could do it now.
Yeah.
Because it was the volume was just too much. They weren't able to take their board exams on time. Many of them were having to either retake the semesters again because they were just overwhelmed with the course load. And
Yeah,
like,
I felt overwhelmed, honestly.
yeah,
And that
for
was
me, it was
12.
like if I didn't go to Columbia, I probably wouldn't have graduated on time because I got so many adjustments and treatments in there because they weren't having to pay for it, and they were just coming through. It was just like a athletic training room essentially. Whereas in our outpatient clinic, we had to like get our own patients, and they had to pay obviously. So these even if it's 20-25 bucks, we kind of suck as students, so we're not really getting outcomes. But you still have to get all these adjustments in and all these exams in. So like a lot of times it ends up being like patients that are passed down through the clinic, or you're out like trying to get friends to come in and see you. But a lot of these people don't have anything wrong with them. So then you're not really seeing pathological cases, until you get out and into practice. Where medical students, because they're in the hospital, they're seeing the craziest cases like right off the bat. And I think that's where the education they need to be tied in more with, like I said, the healthcare system, hospitals, outpatient clinics, to where the Cairo students are seeing, really disc herniations, nasty stuff, so they know what it looks like. So when they get into practice, they can recognize it easier and better. That's just my opinion. Yeah, and I chose that school intentionally so I could graduate faster, just 3 years straight. But yeah, it was a grind. I figured the opportunity cost of 4 more months of working and not paying tuition, it ends up being quite a bit of money. So I was like rushing to get out into practice. I think I was 26 when I graduated from Cairo School.
Nice. Yeah, that's a good age. Honestly, a little bit on the younger side. I'm only a year older than that, but a lot of my classmates were in their 30s and 40s, which I was very surprised.
Yeah, when I was in school, we didn't have very many of those. Almost everybody was around my age. There was a couple that were a little younger, actually, but we did have some in their late 30s and 40s. Particularly people that had military experience, so they were on the GI Bill. Um,
Mm.
and I think the people that I don't know this for sure, but if my memory is correct and my feedback is correct, the folks that entered chiropractic school later seem to have been the most successful in practice as far as like making connections and growing their businesses. And I just wonder if because they were in business before, they had real world experience, they were better prepared to go into practice and to deal with people and to get referrals, as opposed to the young kids like us that just went straight from college to Cairo school and then into the workforce without having a lot of real world experience.
Interesting. Yeah, I'm not too sure about the older students. The people that I talked to in general were about my age, but that makes sense. I mean, experience could do probably nothing but help, so that makes sense.
Right. I didn't spend a lot of time with those guys because, like, obviously I was a single guy with no kids. So I tended to hang out with the other younger people who were,
Yeah.
more social. And, the people in their 30s and 40s typically had families and kids. So they weren't going to be able to go and play volleyball on a Friday night or whatever. Yeah, keeping up with their LinkedIn accounts and stuff like that, it seems like a lot of them have done really well. Just from my class, like one of the chiropractors that I went to Columbia with, he's the chiropractor at the Cleveland Clinic now. So he runs their chiropractic program there. So the Mayo Clinic has chiropractors, Cleveland Clinic has chiropractors, the VA hospital has chiropractors. Um, yeah, so there's a lot of hospital systems that have chiropractors affiliated with them. And I sent you some links. There's chiropractors teaching at Harvard Medical School, Yale Medical School, Dartmouth Medical School. Um, so at the highest levels, obviously there's some integration. It's not the most common, but it's there, obviously. And it seems like the people that are hating on you are missing out on that information, obviously. Um,
Yeah. Yeah, I appreciate all of the additional information. Like school, they'll teach you what you need to know, like for board exams, but like all the information that you know, I think you've gone above and beyond what like the curriculum requires to graduate. So I appreciate all the additional sources as well. I think it helps not only me, but the people that try to make certain comments and I reply with those sources instead of just me talking at them. And I think they
right.
realize like, oh, maybe
This guy
I
knows what he's
wasn't,
talking about.
huh?
Yeah. They're like, maybe this guy knows what he's talking about.
Oh
Huh? He's got
yeah,
all these
yeah,
these
yeah. You,
sources. He's citing his sources every single time.
yeah, you're making me look good. So thank you.
Like I said, I've been in this for a long time, and so I've been dealing with the professional bigotry for a long time, and but the truth is, I've really never experienced it in the real world. Like um, it's always just people online. The most miserable people that want to make that kind of content, or again hide behind anonymous accounts. Medical students and doctors are notorious for just creating burner accounts and just like spamming people's accounts because they know there's consequences for their words if they actually have their name out there, right? That you could sue them for defamation, that you could report them to the medical board for unprofessional conduct, and things of that nature. So they create these burner accounts and just say all the most aggressive, hateful stuff behind their burner accounts. It's so common, and to think that it's that common tells you, unfortunately, a lot about the type of personality that tends to enter the field.
Yeah.
Whether whatever that is. There's a lot of for a field that makes a ton of money and is the cultural authority when it comes to healthcare. There's a lot of misery in the practitioners, unfortunately. You know.
I think you're right. Yeah. The more you say it, the more it's like, oh yeah, like that explains a lot actually. Like,
Yeah.
because sometimes like I see certain people or certain comments, I'm like, what? Like, what is the reason? Like, I just can't understand why some people say certain things. And
Right.
I
What
mean,
does this do for you? Like,
yeah,
you're a doctor. You're out here making $400,000 a year. Like, why aren't you on your boat right now? Why are you in my comment section? Spreading negativity and misery, right? Like,
yeah, pretty much.
like what? This makes no sense. And again, like me, imagine me being a successful person in my field. I spent all my time, going after, I don't know, pick something, a pharmacist or a PT or a massage therapist or acupuncturist, just in their comment section, telling them everything they're doing is wrong. And it would be so weird and so lame and such like low frequency energy, you
Yeah,
know. And again, in my life, what I've realized is everything works in a certain patient population. Things that I dismissed in the past, even stuff that doesn't even fit my worldview that much. Um, I think they all have their place, and it's just if you find the right person for that. Whether it's nutritional content, whether it's like biopsychosocial model, whether it's counseling. Not everything's going to work for everybody. Um, but just because I don't respond well to like talking about my feelings doesn't mean that it's not valid and it doesn't work for other people.
yeah,
Um, it doesn't mean I'm going to spend all my time attacking it. Like, oh, it's not for me. Like, whatever. Even in our office, like, I think only around, just anecdotally speaking, around 50 or 60% of people respond well to cervical manipulation. Like, just from my staff, like, the ones that do like it and want it more, and the ones that don't are like, I don't like the way that feels, So it's not for everybody. So it's finding the right intervention for the right person, and then getting them more of that, or teaching them how to do those things on their own, um, and what they're comfortable with, right? Like, um, yeah,
yeah. And I think going back to your other point, just going out of it's one thing to like to disagree, but like going out of the way and like spending time and energy towards like trying to ruin someone else's day, that's just something I could do, but I just don't want to. Like, People always
Well,
ask, like, people try to like antagonize, like, dude, like, you should respond, like, but nah, not really my thing. And other people can do
yeah,
it for me too. Like, some people
yeah.
that is their thing, and I'm not trying to insult them for doing it. It's just not what I
And I'm
particularly
the
like.
same way, right? Life is short. It's way too short to be miserable and fighting with people all the time and worried about people reporting you or whatever.
Oh yeah.
It's just low vibration, low frequency kind of stuff. Yeah, and it says a lot about those people that they need to spend the time to you're a busy neurosurgery resident. You're over here making TikToks about chiropractic students. Dude, don't you have somebody's like life to save right now? Like, and if you're not doing that, don't you have your own personal life to where you'd want to spend time? I don't know, with your loved ones or like doing something you enjoy instead of just clout gobbling after chiropractors and making hate bait comment on them. Like what are we doing with our lives, my guy? Like you won, you beat the game, you got into med school, you got into neurosurgery residency, like you survived all 6 7 years. Like why don't you go enjoy that and spend instead of spending your time being negative and trying to harm the reputation of a student who's going out there and honestly just trying to help people and help the world, and make people's lives better. You want to attack him and make it to where he can never practice and say he's going to harm people and that you're dangerous. I mean, that stuff is so irresponsible, so childish, and frankly, it's just like I said, it's really unbecoming of doctors to be treating you that way. And that's why we got in contact, because I saw people, making videos about you like that, and I was like, dude, that's crap, man. Don't treat that kid that way. Like he's out here, he's honestly just trying to get into a field to help people and make people's lives better. That's it. He has the best of intentions. And you guys are trying to paint him with this brush and harm him reputationally, harm him professionally, try to get him in trouble with this school and things of that nature, all for just trying to A, educate the public, and B, make people's lives better. And like that's just not cool.
I appreciate you saying that. And yeah, thank you again for all the support. I know other people have seen it too, both sides of the coin, people who are upset with it or happy about it or whatever, but you actually like did something about it and like reached out, and I mean just a simple like message was like above and beyond what the average person would do. Even people like in my own school, in my own class, like haven't been as nice or haven't reached out or haven't like offered support or anything. I'm not saying like I was ever in a bad mental state or anything like that, but you being a complete stranger at the time, that just speaks to like your character, how good of a person you are. So I just want to say thank you for that, because you
Yeah, of
definitely didn't
course,
have
man.
to.
And like I said, like it was pretty clear to me your intentions and meeting you in person. You're a good person. You want to help people, and to have people trying to like make your life harder or whatever. It's just unacceptable. And if I'm in a position where I could like show you how it really is and maybe motivate you or whatever, like I'm going to take that opportunity to try to do that. And like I said, like nobody reached out to me when I was starting out, and people were attacking me or whatever. And so, it's just like pay it forward. If you, as you become more successful and well known and famous, and you see, some younger chiropractor or somebody like that, taking arrows, just do the same thing, man. Just pay it forward, reach out, show them that like there's good in the field, there's good in the profession. There's a purpose in our lives. Like we literally do good, and we try to help people, and we try to make people's lives better. We spent years educating ourselves to do so. And that's a noble effort, no matter what people try to gaslight and straw man and, attack you on a personal level. Like they don't know the amount of people that you're impacting literally with your hands on a day-to-day basis and making their lives better. The hugs that we get when we change people's lives, when they can pick up their grandson again, or they can get back on their jet ski and do the things that they want to do because you've been able to help get them out of pain. Like those things mean something. That's making an impact and a difference in the world. And what doesn't make an impact, a difference in the world, is just spreading negativity on social media. And so, I'm not a mystic guy, but I think that karma is real, and people who go out of their way to harm people, I think that whatever's out there pays them back in kind, and the people that do right by people and try to help people, I think the same thing happens. I think they get the good back to them.
I would agree with that too. Yeah.
So cool. Well, let's wrap it up. Everybody, go follow his account right now. It's right there in the chat. Go give him a follow and get him over the 500 point, and we'll probably jump on here and do a live at some other point.
Absolutely. It's been a pleasure, Doc. Thank you so much again for not only inviting me out to the office, but speaking with you today was great to catch up. And hopefully next time we talk, I should be a fully licensed chiro.
Yeah, buddy. There you go, Doc. You can change your at and your name now, so it doesn't have to
Yeah,
be
I think I was
student.
waiting for the license in the mail for that, so everything is official and no one
Oh
can
yeah,
go
and then you got to
crazy
post
on
it
me. I'm
so you
gonna
can
show a picture.
dunk on all the haters. Be like, hey, check it out. Oh, and you're in Virginia too, so you're actually licensed to the medical board.
Yeah, I had to I forget the exact name, but yeah, you're correct. The same website that I applied to is where the medical doctors and the osteopaths and yeah, everyone
Uh huh.
uses the same source. Yeah, you know your stuff.
I've been around. See, this grade didn't come easy.
Thank you so much, Doc. Great talking to you, and I
Yes,
would
sir.
love to do it again sometime. Maybe we'll figure out the visual part on my end next time.
Yeah, yeah.
You can
We'll
see my
figure it out.
face.
Yeah. All right, my brother. Glad
Thank
you're
you,
back
Dr. Hyde.
home,
I
and
appreciate you.
congratulations on graduating. And yeah, keep doing good in the world, my man.
Thank you so much. You're amazing, and I know at least I'm gonna look back on this time and you I don't think you realized, just to wrap it up, I don't think you realized like you knew that I was a student and I was making videos, but I don't think you knew, I mean you couldn't have known how much like I actually, not only I knew who you were, but like I watched many videos of yours. So like that one message I think meant a lot more than you probably knew at the time. So thank you again for that and for this talk. And yeah, I just appreciate you. So thank you.
Likewise, man. Take care, man.
You too, have a good night.
You guys appreciate everybody for being on with us.
Thank you.